Yesterday we start the topic reproductive system. So we will start male reproductive system. The male reproductive system consists of the testes and a series of ducts and glands. So basically here we have to know about the organs which are present in the male reproductive system. So first is testes, okay, and here we have the all the organs which are given in this diagram. Epididymis, okay, and duct deferens, ejaculatory ducts, seminal vesicles, prostate gland, bulbourethral gland, and urethra semen. So let's talk about each and everything in detail. So what male reproductive system have? Testes, ducts, and glands. These are the three combination which are present in the male reproductive system. Sperm are produced in the testes and are transported through the reproductive ducts. What are the reproductive ducts? So testes, in the testes, the sperm are produced, okay, and it is traveled to the uh, area which help of reproductive ducts. The ducts, ducts is the part of the way the semen will travel. Okay, sperm will travel. Epididymis, duct deferens, ejaculatory duct, and urethra. Epididymis, duct deferens, ejaculatory duct, and urethra. The reproductive glands produce secretion that become part of semen. Some glands will release some substance which will add up on semen fluid that is ejaculated from urethra. These glands are called seminal vesicle, prostate gland, and bulbourethral glands. So one is the production of sperm will happen. One is the traveling part, and third one is the glands which help to more concentrate the quality of sperm. Okay, so those are seminal vesicles, prostate gland, and bulbourethral glands. So these are the three things. If anything is went wrong, so what will happen? The quality of semen is also decreased. So it may be testes, it may be glands, it may be part of this ducts that are ducts. First, we will talk about testes. The testes are located in the scrotum, a sac of skin between the upper thighs. The temperature within the scrotum is 96 point Fahrenheit, slightly lower than body temperature, which is necessary for the production of viable sperm. In the male fetus, the testes develop near the kidney, then descend into the scrotum just before birth. Cryptochidism is the condition in which testes fail to descend, and the result is sterility unless the testes are surgically placed in the scrotum. So basically, the temperature in the body is 96.5. Okay. So here, a slightly decrease because the sperm will the production will happen, and it have the quality. To maintain the quality, we maintain the temperature 96.5. First thing is that. Second thing is that when the male baby in the fetus mother womb, so what will happen? The testis is near the kidney, okay, near the kidneys. What will happen near birth? What will happen? Just before birth, 1 month, between 7 to 9 months. What will happen? The testes will descend into the scrotum. into the scrotum. So what will happen here? Here, the after birth, you can notice that. But some babies, some male babies will doesn't allow the testes will descend into the scrotum. It will stay there only. So it may be congenital defect, a birth defect, anything will happen due to the what may be the reason is. But after birth, what the doctors will do surgically, they will place into the scrotum. Okay. Each testis is about 1.5 inches long by 1 inch wide. Okay, so it is length in 1.5 centimeter, wide is 1 centimeter, and divided internally into lobes. So internally, they are divided into lobes. Here you have the very good picture of the testis. Okay, and then we have the lobes. Okay, each lobe contains several seminiferous tubules. Seminiferous tubules. This is the tubules. Okay, these are the tubules. Seminiferous tubules. These are the tubules. You can see that these are the tubules. Okay, here, till here, sorry. In the testis only, not here. So this is the seminiferous tubules in which spermatogenesis takes place. The formation of primary, these steps will involve in this process. New cell, spermatogonium, spermatocyte, secondary spermatocyte, spermatids, and spermatozoa, mature sperm. This spermatogenesis will happen. Okay. Among the spermatogonia of the seminiferous tubules are sustencellar Sertoli cells, which produce the hormone inhibin when stimulated by testosterone. Between the loops of the seminiferous tubules are interstitial cells, which produce testosterone when stimulated by luteinizing hormone from the anti-pituitary gland. Besides its role in the maturation of sperm, testosterone is also responsible for the male secondary sex character, which begins development at puberty. So basically, here two hormones are helping. Already yesterday we talked about that is luteinizing hormone, okay, and FSH, follicle stimulating hormone, and testosterone. These three hormones are responsible for the formation of spermatogenesis and maturation of sperm and male sex characters like beard, hair, voice, walking, strong muscles, all this due to this hormones, testosterone mostly. Okay, so here you have the FSH. This table will give the detail like FSH initiates production of sperm in the testes. Initial begin with FSH. LH will secrete testosterone by the testes. So to need testosterone, we need LH. Testosterone, what will do? It promotes sperm, develops secondary characters like reproductive organs, growth of rarings, facial and body hairs, muscle build. This will do testosterone. Inhibin, what inhibin do? Decrease secretion of FSH to maintain constant rate of spermatogenesis. It will decrease. Again, it will decrease because already spermatogenesis will started, initiated. Now, now you need FSH to decrease. First, we will complete the process, first process, then again inhibin will decrease, then FSH increases. FSH decreases, inhibin increases. So likewise, they will maintain the process. Okay, this is very important. You have to understand. Now, this is the process how the sperm will form. Okay, in the testes. Now, what are the parts of the sperm? The sperm consists of several parts which are shown in figure 21. The head contains 23 chromosomes. On the tip of the head is called acrosome. can see this diagram. This is the uh, diagram. Matured sperm. This is the acrosome. This is the nucleus. This is the centriole. This is the mitochondria. This is flagellum. Head, middle piece. Okay, this is the structure of sperm. On the tip of the head is acrosome, okay, which is similar to lysosome and contains enzyme to digest the membrane of an egg cell. So acrosome is very important because the egg, this is the egg, this is the sperm, this is entering. So entering, you need to digest this layer. To open this layer, you need acrosome. Within the middle piece are mitochondria. Mitochondria will produce the energy to move forward. Okay, ATP. The flagellum provides motility. Smoothly, you want to go, you need one tail. It is nothing but flagellum. Okay, the capability of sperm to cell to move, it is beginning of the flagellum that requires energy from ATP. Sperm from the seminiferous tubules enter a tubular network called the rete testis that enter the epididymis, the first of the reproductive ducts. So here the sperm is produced. Now it will enter into seminiferous tubules to the epididymis. Okay, so then this is the beginning of reproductive ducts. So here the process of production of sperm is happen. Okay, then the structure is discussed here. So let it enter into the reproductive ducts, the pathway of the ducts. Here you have the, I think this this is the testes. We can see that this is the ductus deferens. This is the scrotum. Okay, this is the testes. This is the epididymis. Okay, you can see that this is the epididymis. Now it will enter into the ductus deferens. Ductus deferens to the, here you have the prostate gland. This is the prostate gland. Okay, this is the ejaculatory duct. Okay, this is the membranous urethra, and this is the uh, bladder. Okay, urinary bladder. This is the bulbourethral gland. This is the gland, prostate gland. Okay, seminal vesicle. This is okay. So these are the glands. Prostate gland. Okay, next epididymis. So we know that this is the epididymis. After scrotum dust is, then we have epididymis. Epididymis is a tube 6 meter. 6 meter. This is long, but here it is very thin. It is attached nearby. But if you elaborate that, it will become 6 meters. Coiled shape. Within the epididymis, the sperm complete their maturation. So maturation will happen in epididymis, and their flagella become functional. So here, flagella become functional. Smooth muscle in the wall of epididymis propels the sperm into the ductus deferens. So here in the epididymis, we have smooth muscle. Will contract and will release the sperm into forward to the duct deferens. So this is the duct deferens. Here we have the duct deferens. Here we have the duct deferens. This is the duct deferens. You can see all this is the duct deferens still here. Let's talk about duct deferens. Duct deferens, also called vas deferens. The duct deferens extended from the epididymis in the scrotum on its own side into the abdominal cavity through the inguinal canal. This canal is an opening in the abdominal wall for the spermatic cord, a connective tissue shell that contains the duct deferens, testicular blood vessels, and nerves. Because the inguinal canal is an opening in a muscular wall. It is a natural weak spot and is the most common site of hernia formation in men. Once inside the abdominal cavity, the duct deferens extends upward into the urinary bladder, then down the posterior side to join the ejaculatory duct on its own side. The smooth muscle layer of the duct deferens contracts in waves of peristaltic, a part of ejaculation. So you can see that this is the path behind the, you can see that abdominal cavity. So most of the persons will have, this area will have inguinal hernia, which will maybe block, also block this vas deferens. This is the very, smooth area with the very, if anyone have uh, kick here uh, or any harmful object thrown here, so what will happen? It will be really very painful. So basically, you have to protect it. So basically, during the biking ride, so what will happen? We will not. Most of the men's will not see these things, because if you sit like that, what will happen? Most of the duct difference will pressure. This is the front part of the back bike. It will compress. So what will happen? The testes which are sending the sperm is will not reach to the area. Okay, and the quality of the sperm also decrease, because already there is a sperm, but FSH is not activated by the inhibin, because inhibin is high. What will happen? The sperm count also decrease. So this is one of the most reason of bike riding. So you have to conscious about that. Okay. So here duct difference. Duct difference will reach here, that is called ejaculatory duct. And we have seminal vesicle also. We'll talk about that also. Yeah, and another thing is that they are the nerves, the arteries which attach to the seminiferous tubules, epididymis are very high. The nerve supply is very high. The circulatory system is very high. You can see the nerve, okay, all the arteries and nerves all there. Okay. This is the one seminiferous. You can see that in that we have capillaries, okay, interstitial cells, okay, lumen. Okay, these are the spermatids, spermatocytes, spermatogonia, spermatozoa will happen, sperm cells. Okay, this is the very natural process. Next, we have ejaculatory ducts. You can see that this is the ejaculatory duct. This is the ejaculatory duct. Let's talk about ejaculatory duct. Each of two ejaculatory duct receives sperm from the defense, vas deferens or ductus deferens, and the secretion of the seminal vesicle on its own. Both ejaculatory ducts empty into the single urethra. Next to a seminal vesicle, you can see that this is the seminal vesicle. Ejaculatory duct, duct deferens, seminal vesicle, and ejaculatory duct. So this is the seminal vesicle. So let's talk about seminal vesicles. Are posterior to the urinary bladder. This secretion contains fructose. So here, seminal vesicles is the gland. It releases fructose to produce energy to sperm and is alkaline to enhance sperm motility. The duct of each seminal vesicle joins the duct difference on that side to form a ejaculatory duct. So seminal vesicle will release fructose to the sperm. So what will happen? It will give boost the energy, and the second is to enhance the motility. Next, we have prostate gland. This is also one of the important gland. Okay, a muscular gland just below the urinary bladder. The prostate gland is about 1.2 inches, high by 1.6 inches, width by 0.8 inches. So this is we need to know anatomy, because in the urine abdominal, USG abdomen, all the related gland anatomically they will give. The increase in size means this is the increase in size of prostate gland. It's around the first inch of urethra as it emerges from the bladder. So it is attached to the urethra. So whenever size increases, it will constrict the urethra. So that's the reason urine bubbling, urine formation is not happening. Urine output is less. Okay. The glandular tissue of the prostate secretes an alkaline fluid that will help maintain sperm motility. Again, prostate gland will help to release fluid, okay, which maintain motility. The smooth muscle of the prostate gland contract during ejaculation to contribute to the explosion of semen from the urethra. So here, prostate gland will help because it's the smooth muscle to release the semen from the urethra. Okay, understood. So this is the about seminal vesicle, prostate gland. Seminal vesicle have fructose. Here we have the substance, alkaline substance, which improve the mortality rate. And next we have bulbourethral gland. Now the three glands we to discuss. Now we will discuss about bulbourethral glands, also called Copper's gland. The bulbourethral glands are about the size of peas and are located below the prostate glands. Let's see the bulbourethral gland. Here we have the bulbourethral gland. You can see that this is the below the prostate vesicle, above the prostate gland. This is the prostate gland. This is the vast difference. This is the seminal vesicle, epididymis, testes, scrotum. In the scrotum and the testes, we have seminiferous tubules. Okay. Now we'll talk about bulbourethral gland. Their alkaline secretion, also they are released alkaline secretions, coats the interior of the urethra just before ejaculation. So they coat all the urethra. So if this is urethra, they coat, they cover, okay, they cover for ejaculation means it is releasing for both urine, both for semen. Okay, because urine is an acidic nature. To protect the urethra for damage, it is producing alkalizing nature substances by the urethrobolbar gland. You have probably noticed that the secretion of male reproductive glands are alkaline. This is important because the cavity of the female vagina has acidic pH created by the normal flora, the natural bacteria population of the vagina. The alkalinity of the seminal fluid helps neutralize the acidic vaginal pH and permits sperm motility in what might otherwise be an unfavorable environment. So here, one important thing we have to notice that the during most of the infertility cases is due to the here reduce alkaline nature in the male or increase acidic nature in the female. It is also one of the cause. So that's the reason we will in electrohomeopathy we will neutralize this. Okay. So what will happen if the alkaline nature is in the semen is normal high compared to pH level of female vagina. So what will happen? It will balance. Then the formation of zygote will happen. Okay, egg will fertility will happen. But here pH level is high, alkaline, no alkaline nature is there. What will happen? This pH level will kill these sperms. So we need to maintain the alkalinity. So that's the reason every gland is this alkaline nature things, even vesicles, bulbar secretions or prostate gland, everything. Okay, to maintain the alkalinity. Now we'll talk about urethra, penis. The urethra is the last of the ducts through which semen travels, and its longest portion is included within the penis. The penis is an external genital organ. Its distal end is called glans penis and is covered with the fold of skin called the prepuce of or foreskin. Circumcision is the circular removal of foreskin. This is a common procedure performed on male infants, and though there is a considerable medical debate as to whatever circumcision has a helpful purpose. Such research studies have found fewer cases of HIV infection among circumcised men compared with men who are uncircumcised. Within the penis are three masses of cavernous. This is for type, cavernous tissue. Each consists of a framework of smooth muscle and connective tissue. that contains blood sinus, which are large irregular vascular channel. So let's see can see that. This is the diagram. Okay. From this area, you can see that this is the urethra from here to here. Okay. And this is also route of urine, route of semen also. This is the first thing, that is corpus cavernum. This is corpus spongiosum. This is cavernous urethra. This is both. These are the responsible for erectile. Okay. This is gland penis, foreskin. So this is all. This is circumcised. Some persons, some men, and this is perineus, gland penis. So these are the names. From here, this is the cavernous spongium. This is the cavernous cavernosum, corpus cavernosum. Okay. Now these are the responsible for erectile. Hmm. When blood flow through the sinus is minimal, the penis is flaccid. So normal blood flow will remain. The erectile is no erection is there. Okay, but during sexual stimulation, the arteries to the penis dilated and sinus fill with blood, and the penis become erect and firm. The dilation of pineal arteries and the resulting erection are brought about the localized release of nitric oxide and a parasympathetic impulse. The erect penis is capable of penetrating the female vagina to deposit sperm. The culmination of sexual stimulation is ejaculation. The sympathetic response that is brought about by peristalsis of all of the reproductive ducts and contraction of the prostate gland and the muscles of the pelvic floor. So during sexual stimulation, so what will happen? The arteries and the veins are dilated. The arteries are dilated. So large number of blood will come. So it will form erection. So what will happen? So then after uh, intercourse, so the the semen will travel to the vaginal part. Okay, then the fertility will happen. Next is semen. Last part, semen. What semen consists of sperms and secretion of the seminal vesicle, prostate gland, and bulbourethral glands. Its average pH is 7.4. During ejaculation, approximately 2 to 4 ml of semen is expelled. Each milliliter of semen contains about 100 million sperm cells. Okay, so for 2 to ml of semen is expelled. So this is the normal value. Okay, so and each millimeter contains 100 million sperm cells. So for this, only one after that fertility would happen. So this is all about how the sperm is formed, where the sperm is formed, what ducts are required, what glands are required to discuss. So here the three things we need to understand, we need to remember. That is, one is reproductive glands, reproductive organs, reproductive glands, reproductive ducts. Reproductive glands, ducts are epididymis, duct deferens, ejaculatory duct, and urethra. Glands are testes and urethra, urethro bulb, and prostate gland, and next is semina vesicle. So these are the glands, and testes are the production house. We need three hormones, 3 or 4 hormones: FSH, LH, testosterone. To stimulate or inhibit, we need inhibin hormone. To stimulate, to decrease the releasing of SHH, we need inhibin hormone. If inhibit high, FSH low. FSH is high, inhibin is low. Okay, so this is all about male reproductive organs. So basically, so we have to understood where the problem is, that we have to do examination. We have to ask the patient about all these three things. Okay. So, but in my opinion, that main important is hormones, because due to the disturbed life, disturbed activities, low sleeping, less exercise, no food proper. Okay, these are the responsible for the infertility cases, most of the infertility cases. Okay, so we talked about male reproductive system in detail. So please note down all the, this is very, very important. You will get the cases, more cases. Nowadays, infertility cases are more. So you will get definitely the cases. So you have this, all the knowledge about the male reproductive system. Then you can easily treat. In electromaterial, you have S3 and for male reproductive organs. S3 will work wonderful. S3 RE. RE you can apply for testes. S3 for internal, external, both you can use. Okay. So this is all about. Any doubt you can ask.